The following portion of Good Day PA is sponsored by WellSpan Health. Deep vein thrombosis, or DVT, occurs when a blood clot forms in one or more deep veins of the body. Now, for a long time, treatment for patients meant putting them on blood thinners. Now, there's a way to get rid of the clot altogether. Dr. Leon Salem will tell us about that. First, tell me more about what deep vein thrombosis is.
Yeah, thank you. So, deep venous thrombosis, or DVT for short, is a condition in which clots form in the deep veins in the body, most commonly in the legs. The reason why it's important is because when those clots extend, they can break off and go to the heart and lungs, which may result in potentially life-threatening complications.
Okay, so first things first, what are the symptoms that we need to be aware of?
Right. So the common symptoms are acute onset of leg swelling, leg pain. Sometimes there's red discoloration. It's mostly in the calf. Some people have difficulty walking. However, some people have no symptoms at all, and it's something that is incidentally found in testing later on.
Now, as you mentioned, this can be dangerous.
That is correct, because if clots from the leg break off and go to the heart and lungs, that could result in life-threatening complications.
Are there certain risk factors that can complicate this?
Yes. So the main risk factors are immobility. So this can be something that may be related to patients that have debilitating conditions that cannot get around, but also it can happen just with long car trips or long flights. Other risk factors are any trauma or surgery. Obesity is another risk factor, as well as some genetic conditions or medications such as hormonal replacement therapy or hormonal birth control.
So if this happens, what are the treatment options?
So the mainstay of therapy is anticoagulant medications, or blood thinners as they are commonly known. And the reason that those medications are given are primarily to reduce the extension of the clot that is in the veins and reduce the risk of it breaking loose, going to the heart and lungs, resulting in life-threatening conditions. Unfortunately, about 50% of patients that are treated only with blood thinners will have long-term complications due to damage to the valves of the veins and incomplete resolution of the clot. Therefore, we offer a different way of treating those patients that involves the mechanical, physical removal of the clot. This is done in the cath lab. It's a minimally invasive procedure that is done under local anesthesia and is associated with just minimal discomfort. It is done through an IV that is placed behind the knee. Through the IV, we place a device. This is the device. It looks a bit like a Chinese finger trap.
It does, yes.
And it just, we put it above the clot, and as we pull it down, it just scoops all the clot in the vein, it just comes out through the IV that's placed behind the knee.
Oh my gosh, that is so interesting. How can someone contact you to learn more about this?
So they can contact me through my office or online through our website. We see all patients, and we're happy to help our community with this common but difficult problem.
Yeah, difficult problem, but treatable problem.
Yes.
So thank you so much.
Thank you.
Good to have you with us. The previous portion of Good Day PA was sponsored by WellSpan Health.